out so that people can understand what COVID is?
So putting it very simply, COVID is actually a viral infection. It is caused by a group of viruses called as the coronavirus family, specifically a novel virus, which has been labeled as SARS-CoV-2. It gives you some specific symptoms. I think the 3 specific symptoms recognized in the UK are your high-grade fever, a continuous cough, and a loss of smell and taste. But we have been seeing a lot of people come in with very atypical symptoms. One of the symptoms which you can come up with is gastrointestinal symptoms. You can get diarrhea along with that. And some people can present with stroke or some peripheral neurovascular problems. Like we had a case with Guillain-Barré syndrome, putting it very, very in a public domain. It's like you get sort of ascending type of paralysis. We've had some patients who presented with diabetic ketoacidosis, and these patients never were known to be diabetic. So there is a whole spectrum. But the main problem which has happened with COVID, the reason why so many people have died, is it causes problems with your lungs, problems with your breathing, and problems with your oxygen delivery. So you'll find a lot of patients get hypoxic. And in normal patients, when they get hypoxic, they actually increase their respiratory rate. They look very, very disturbed. आपको पता चलता है कि ये patient में oxygen कम है क्योंकि patient hyperventilate करना कोशिश करता है. The respiratory rate goes very high. But in COVID, we came across a very atypical presentation, which was called as happy hypoxic, that the patients are hypoxic and their oxygen levels are low and they don't know about it. So this goes to a point where they suddenly have a cardiac arrest and collapse at home. And that's the reason you'll see that the mortality in COVID is very high. And generally, if you look at it, if you're admitted to a hospital and you need a ventilator, your mortality can be anywhere from 30 to 50%. So it is an extremely dangerous condition and it spreads very easily. That's the reason why I think this has become a pandemic, because when COVID initially came, we had something called as R number. R number क्या होता है कि एक आदमी से कितना आदमी को एक वायरस फैलता है. So different viruses have different R numbers. जैसे कि अगर आप measles लो, measles has a R number of 9, and if one patient can give it to 9 patients, and that 9 patients can give it to another 9 patients. So you can see how quickly people in a room can get infected. As a COVID का R number initially was around anywhere between 3 to 5. So a lot of people were getting infected. Then we became slightly clever. We knew things like you have to wear a mask, you have to wash your hands, you have to socially distance. With these kind of lockdown measures, it's possible to get the R number down. So in very short, COVID is a very dangerous virus. इससे आपकी जान चली जा सकती है, and you have to be extremely, extremely vigilant against it.